Hi guys, I'm Doris Okafor Dike, coming to you from Dike Law Group. Now today, I'm coming to you January 2020 because of COVID. Yes, we are still here in COVID with another variant, Omicron. Now Omicron is, as we all know, different from any other variant because it's getting everybody sick. But just because Omicron is prevalent doesn't mean you are able to not follow the CDC and OSHA guidelines, especially if you're a healthcare employer or any employer at that. Now, if you are still requiring your employees to come in the office, see patients, deal with the other employees, you have a obligation to keep your employees safe. At the minimum, I would suggest reading the CDC guidelines. However, you also have to read OSHA guidelines as well. Now, I have a current client who is requiring their employees to come in because, as we know, employees are more productive when they come in. However, they are not necessarily requiring them to wear masks. They're not requiring them to follow any OSHA guidelines. They're not requiring them to follow any CDC guidelines. And now 30 employees are sick with COVID. Now, if any one of those employees complains to OSHA, they're going to have a serious violation on their hands. Now, maybe you don't care if you have an OSHA violation, but you should if you're a healthcare employer and you want to have a reputable business that attracts quality employees. OSHA tends to put a list of their violators on their website with the fines that they have given those entities. You don't want to be on OSHA's bad side. Now, I think there is some confusion surrounding OSHA and the coronavirus because some might think that just because the vaccine mandate is now being argued in oral arguments on the Supreme Court means that we don't have to follow any of OSHA's guidelines surrounding the coronavirus. That's absolutely false. Now, the vaccine mandate is being hotly contested. However, all of OSHA's old guidelines surrounding the coronavirus still need to be followed at a minimum, which means you also need to keep a log of all employees who could potentially be exposed to COVID. For instance, if you got one person who tests positive for COVID and there are other people who work around them, you need to monitor their symptoms. And if they develop COVID too, then you have to put it on one of OSHA's logs for a workplace illness. There are other guidelines too that you'll have to also review and look at. And here at Dike Law Group, we can help you with that. But it's super important, not just for the thriving of your business, but the reputation of your business matters too. And that means that taking care of your employees should be paramount. This is Doris Dike signing off. Thanks.